So once again, welcome to our panel on the future of AI and digital therapeutics. It's an exciting conversation today. We're going to have Dr. Dava Newman, who is the director of MIT Media Labs. We have Dr. Daniel Kraft, who's leading the space in quantified health from Singularity. And really, I would say one of the pioneers in digital medicine. We have Dr. Deepak Chopra, who's also joining us to really talk about the future, his wisdom and his vision for what healing is and what does the physicians of the future look like? And then we have Rajiv Kaul, who's a biotech investor. So with that, let us kind of dive deep into the conversation. I want to kick off the first question.
Yeah, so I would love to just, if you can kind of paint a picture for us of the things you're investing in and looking at. Rajiv, I know you're making a number of investments in the space, and all of you are doing research in the space and work. But 5 years from now, 10 years from now, if we talk about a horizon out there, how is humanity changing? What are the things that are in the advent of technologies today that we're going to see a very different society for maybe a decade from now? And I'd love to just see what are the most out there ideas or out there investments and kind of technologies that you're exposed to these days. And we could go down the list on this, but Rajiv, in particular, I know you're making a number of investments in the space. What are the companies that are probably the most disruptive right now that you're seeing, and where do you see that future kind of heading?
I think Rajiv must be having some issues. Why don't we?
Yeah. Then I would just turn it over to any of the other panels. But Daniel, maybe if we could hear from you on that first, that would be great.
Of course, AI is easy, AV is hard. You can always use that line. I think big picture where we're hopefully heading in the next decade, there's that famous quote from Bill Gates that people tend to overestimate what can happen in a year and underestimate what will happen in a decade. I think the next 10 years will make the last 10 years look quite slow on this exponential. And hopefully, 10 years from now or sooner, we're going to leverage this explosion of big data, whether it's from our wearables like an Oura Ring or our digital exhaust, our Internet of Medical Things. We'll start to be able to synthesize that using AI machine learning to really give us a shift from sick care to healthcare, being much more proactive. Each of us will have a bit of a digital twin that can simulate what helps us optimize everything from our mental state to our physiologic state to optimize health span, not just lifespan. And then will come something actionable and integrated into people's lives in a way that matches them, their age, their personality, their incentive structure. And then the incentives align and the regulatory elements align for that as well. So it's an exciting age, not just with digital therapeutics, but to have this sort of digital AI enhanced layer to really move from one size fits all health and medicine to one that's much more data driven, intelligent, hopefully crowdsourced. So we're all sharing information across the spectrum. And there's lots of, especially with COVID as a catalyst, some of those dots are starting to connect.
Dr. Newman, from your perspective at the MIT Media Labs, you're doing amazing work. I've been tracking the work in the affective computing department. Can you share some of your insights into some of the research which is happening at MIT? We look at things like continuous monitoring and predictive analytics, which is kind of the backbone for us to really bring in digital therapeutics.
Absolutely. Thank you so much. It's wonderful to be here with you all. And when it comes to affective computing, I'm so glad you started there. Sure, artificial intelligence, but affective, it's about people. It's always about people. It's not about our machines and our algorithms. It's about how are we living healthy and well and into aging. And it's the affect. It's people. We've been running this incredible experiment now during that pandemic. As a rocket scientist myself, space is isolated, confined environments. So we've all been living in isolation. And we know these unbelievable implications now in mental health and wellness and physical health and wellness when we're really, really very confined. So it's the future looking forward. How do we be our best selves? How do we be the best selves ourselves, physically, mentally, and then for our communities? And I think it starts right there, where it's going to be the affect. It's going to be the listening, the reflection. Maybe those are some of the wonderful things that have come out of this isolated, confined environment experiment. That's how we train astronauts. We didn't think we'd train the entire world. We're all ready to go to space now because of what we've been enduring. But hopefully to a little bit what Daniel was saying, the digital, we really is a digital twin. We have a copy of ourselves. That's kind of the computation, the AI behind the scenes, but it'll be very customized. Be very, very customized. What do I need? How can it help me today? Live my best healthy wellness. And like I said, it's physical, it's mental. It'll be behind the scenes. It won't be I love that. AV, the technology, we're all struggling with, but that digital seamlessness is what I would say. That affect is going to bring out the person, bring out the relationships. What are we all missing? We're missing that three-dimensional in-person relationship. So I think it starts there with the people, but using our digital capabilities behind the scenes to customize and to tailor medicine and experience. And that's a game changer. The real customization and the real-time nature of our data and our data analytics now as well.
So Deepak, looking at, as a physician, you've seen over the last, I guess, several decades, how medicine is, like you said in your words earlier on, you need to stop practicing and really start healing. Can you paint a picture of how do you see digital therapeutics in a very different way from conventional medicine? How do you see digital therapeutics being integrated into preventive medicine, integrative medicine? We today, as Daniel said, we have the ability now to have a clinic in the cloud, hospital in the cloud. I think everything is going cloud. So can you just share your vision of how you see digital therapeutics unfold?
So in the 1980s, thank you, Punacha. Thank you, Dr. Dava, for being here again. Thank you, Sharon. So in the 1980s, I did start speaking about the inseparability of mind and body as two experiences in consciousness or awareness. The problem was there was no validation for anything I was saying at that time. Today, there's no experience that cannot be measured. Right now, as we are having this experience on Zoom or wherever, YouTube, our brain frontal cortex is responding with neural correlates of this experience. So there's no experience, no thought, no image, no feeling, no sensation, no perception, and its interpretation that doesn't have a biological correlate. So, as you know, in the ancient wisdom traditions, there's something called bioregulation, but we have never actually embarked on this in our societies. Now it is possible. So, just to give you an example, less than a year ago, I partnered with Fitbit to create instant monitoring of biological data, heart rate variability, breathing, oxygen saturation, skin resistance, electrodermal responses, and then in real time intervention through either mindfulness or breathing or through exercise or shift in imagination or emotion. We had 1.3 billion media hits. So that's where the future is going. Now that we know a lot about vagal stimulation, the polyvagal theory, it will be possible to teach people through technology to instantly not only get feedback of their biology, but instantly intervene in real time. And when we get that information, that expands our self-awareness and our ability to regulate our bodies. So I see the connection between voice tone, eye movements, facial expressions, micro expressions, heart rate variability, every biological parameter, including emotions, and then real-time intervention so we can become masters of our body, of our mind, and even of our environment, as Dr. Dava has so elegantly explained.
Thank you, Deepak.
Rajiv, I know you're making a number of investments in the space right now. I'd love to just kind of, for startups, entrepreneurs, people who are looking into this ecosystem right now, what are some of the things that you find the most exciting? Where are some of the areas that you find the most capital being put towards, and the probably biggest disruptions that can take place over the next few years?
Rajiv, can you hear us? Or I know Rajiv's coming in from Berlin, so.
Okay, not sure if you could hear us, Rajiv.
Yes, we can hear you.
Yeah, okay. I hope you can hear me. And I'm sorry if my streaming's been working well. I'm not sure what's going on. Very happy to be here. And I'll just pick up on some of the points Deepak just made about Fitbit and behavioral modifications. I think one of the big areas of therapeutics, digital therapeutics, where one can have big impact is behavioral modification. People play video games and they feel much better. I think it's you play the video.
Okay, we lost him. So why don't we go back and let's go back and talk to Daniel.
Well, I think he was starting to mention this idea of video games, which as a digital therapeutic in the last summer, the first video game out of MIT, a group called Achille Labs, was through FDA approval to treat kids with attention deficit disorder with a video game, essentially, as opposed to a drug. And that's this idea of digital therapeutics. How do we essentially democratize, digitize, and almost demonetize therapeutics? Some of them can be through a video game. Some of them can be, the feedback loop from not just our wearable devices, our voice as a biomarker, our connected homes that can give us real-time insights and provide that data to the individual or the caregiver in a way that really matches them. So it's an exciting time to leverage new forms of data, to make sense of it, to crowdsource it. And I think the video game element is one element. And of course, you've got VR and AR and heart rate variability, et cetera, as Deepak mentioned, and the ability to leverage that into our behaviors, I think, is key. And you can imagine in 10 years, we're all going to have our own sort of personal avatar or Jarvis that can really match our age, language, culture, and nudge us in the right directions for behavior, which can hopefully prevent many diseases. If you have a condition, leverage, I think, everything from your real-time glucose to real-time blood pressure, just coming to your wristwatch to enable digital therapeutics in smarter ways as well.
So Daniel, I know you started this initiative called digital.health, and it's all about taking people from healthcare, traditionally from sick care to healthcare. Can you just shed some light into what is your vision with AI and what is the digital.health initiative?
Briefly, the current site, which is evolving, is to be a bit of a digital health formulary. There's so many new sort of, whether it's a wearable or apps or platforms that are becoming available. Most clinicians don't have any idea what's available now. You could prescribe Headspace for stress and anxiety. Early in the pandemic, Deepak, I did your amazing 30-day session and shared that with friends. That was useful therapeutic in the early stages of the pandemics. There's connected blood pressure cuffs. There's a whole new sets of platforms. You need a way to sort through those and eventually be able to prescribe them and have eventually insurance companies cover them. So digital.health is a place to kind of find what's out there and for clinicians of any TORP to start to prescribe them.
I have a question just for everyone on the panel, but let me start off by asking you, Dr. Newman. It seems like with a lot of the biometrics, we're moving from being able to sort of analyze the external to suddenly being able to analyze the internal in a way that we never have before. And you can see sort of the potential danger of this, or the ethical dangers of an authoritarian regime, basically being able to monitor someone to such a level where if they looked at an image of the dictator and they had internal anxiety, they would be able to tell that more than anything else now. Is there a danger somewhat of how these things are being introduced? Are there ethical concerns we need to think about as this data first is being made widely available, and very different countries are going to use them in different ways? And how do you think of that?
Thank you for the question. It's a great question. I actually love the image of looking inside, which we are. We're looking inside with our nanotechnology, and we're looking outside. And of course, for me, looking outside for life, in the universe to teach us about ourselves. And bioethics, AI ethics, that's not a nice to have. That is the community. I'm also looking at the chat. AI is a tool. AI is mathematics. We weren't scared of mathematics. There's not, so don't believe what to read you weren't scared of mathematics. That's just knowledge. Just knowledge. They're just tools. It's all about the people, and we're the actors. And how do we use our tools? This is the digitization, all this real time. And so we have decisions to make. So you always want, I am a technologist, but guess what? I always want the ethicists, I always want the equity person to brainstorm with me. How do we deploy our tools? How do I deploy my technology? Everyone has a say in that. And we have some examples where we've gone it wrong. So guess what? Lesson learned. How can we do it in a way that is ethically, has all the judgments we'd like? That's where the human comes in. This is always about humans. It's really, in my opinion, not about our technology. These are just tools that I use to accelerate positive behavior, positive well-being, so that mastering the body, mind, and environment, all living things, how do we do better? How do we do better? And these are just tools that we use. And let's have the discussion. You have to be transparent. We have to have everyone at the table. And to your question of the ethical ramifications, the best way I know how to do it is have experts in the rooms and to talk about it and not hide anything. Be very transparent about it.
Yeah, and in some cases, I think this technology is moving so fast that one regulation and government kind of understanding of it may be moving much slower than innovation at this level that we're living in. Daniel, I would ask you a question as well. There's been a lot of talk about brain-machine implants. I know Neuralink is trying to make great strides in this as well, mind-to-mind communication, things like that. How much of this seems to be sci-fi, and how much of this seems to be really practical steps that we're going to see over the next maybe decade ahead in what you've been learning?
Well, along the exponential, things are getting smaller, faster, cheaper, to the point where you can put a chip on the brain, it's not new, and enable, let's say, someone paralyzed to control a robotic limb, or now, as published last week at UCSF, to allow someone paralyzed and locked in to think and to have text. So that's pretty magical. And Elon and others are trying to bring this to the consumer side. I think that's probably not our first application. There's lots of risk to putting hardware in your brain, but things are getting less invasive, from sort of wearable EEGs to our friend at building sort of wearable MRI machines. So we're going to have incredible new ways to look inside the brain. Optogenetics and other tools out of MIT are really going to help change mental health, as well as the ability to connect our brains in new forms. I don't think we need to get too sci-fi, but the future is coming faster than we think.
I might add on that, if I can, just because you mentioned the optogenetics. I mean, this is breakthrough scientific discovery, and again, just to make the point that it's enabling, because what we envision with our Center of Bionics here, the Media Lab, and our Government Center, we get the world rid of disability. We don't think about disability. Everyone is able. Everyone has so many abilities. So that's how we think about it. And that's where some of these things like that's how they help. That's how they help internally in the body, giving everyone, their beautiful abilities, mind, spirit, body, physical.
Deepak, I have a question for you then. It seems like with all of this technology, technological evolution has hijacked biological evolution by leaps and bounds, right? We are the first time really transforming everything we can by our biology, by our technology. What will we be as human beings when we are, looking at the world 20 years from now and communicating mind to mind, perhaps, or having all of this technology living for maybe double our lifespan? How will that change us as just a society that interacts with each other? What do you predict?
So Sharad, it all depends on our emotional and spiritual maturation and integrity. Otherwise, these technologies can be very destructive and ultimately even bring about extinction. We have not evolved since tribal times. We're still living in medieval tribal mindset with modern capacities, and that's not a good combination. So ultimately, what we're entering right now is what I would call the ultimate age of entanglement. That's what the Internet of all things will be. Everything is entangled with everything across space and time, and the singularity, which is beyond space and time. Knowing that, it is very important that our imagination and our creativity, which precedes technology, has to sync up with our emotional and spiritual development. Otherwise, we're doomed. So one of the things that I think I would really emphasize with artificial intelligence is to actually cultivate self-awareness and cultivate ethical qualities like empathy, compassion, joy, equanimity, cooperation, and emergence by combining our collective strength, our collective creativity, shared vision for a more peaceful, just, sustainable, and healthier world. And if we keep that in mind, I think we have the technology and the know-how and a new story. And 5-10 years, we will hopefully emerge into that new story, which will be quite amazing. We're moving in the direction of singularity, slowly but surely.
Thanks, Deepak. And Deepak says infinite flexibility is a key to immortality. So with that, I'm going to ask Rajiv, third time's a charm. Rajiv, what do you do kind of finish?
Let's see if it works.
There you go. I told you. Just have to stay at it. Flexibility. Go for it, Rajiv.
Well, I weld on what all of us are saying here, which is I think we have these exceptional tools. We live in this great moment of time when we can decode the genome, we can write DNA, and we connect that to the phenotype.
Okay, so I think we will have to give up on this. I'm going to go to Daniel right now because he seems to be the guy. Daniel, you've been on the pandemic task force, and can you share some of your lessons learned? How has policy been accelerated? How has digital therapeutics been kind of now everything's being fast tracked? Just paint a picture on how has the pandemic and what has been the response, and how do you see the world? You know, now coming out of it or still in it. What is your vision?
Sure. Well, a lot of it now is not about making new technology, but connecting the dots and enabling it. Telemedicine wasn't new, but it accelerated through the pandemic. New forms of diagnostics, new forms of therapeutics. I've been the chair of the XPRIZE Pandemic Alliance Task Force for the last year and a half, with folks from MIT to small startups to Microsofts of the world. And part of the lesson was we can converge and cooperate in new ways to solve pandemic challenges, but those lead to hopefully future elements that address everything from the mental health to public health to prevention and beyond. So I think some of the lessons are, again, it's not about the technology only, but how we put it together. How do we align incentives for both payment models, which change for telemedicine, as well as regulatory, and the FDA has accelerated their paths. And so I think some of hopefully that energy will bring us into this new health age as we move forward, not again just for sick care, but for healthcare. And AI, machine learning, plays a big part of that. Data has been a big part of addressing the pandemic, and a lot of it's still stuck on fax machines. So I think as we move into this next era, we need to think better how to align incentives, unsilo the data, so we move from just data to insights and knowledge, and then narrow the gap between that knowledge and what could be applied at the clinic or in your pocket or through telehealth for mental health and beyond.
Thanks, Daniel. So when you look at, I guess, the global impact of AI in emerging markets, it is so important for us now to be able to share data, have transparency in data. And Dr. Newman, Deepak, anybody out there in the panel, the question is, what is your vision? Do you see any thought leadership happening in the space of data transparency and privacy, which is so critical for AI to be successful?
I think the era is coming where there will be no secrets, there will be no privacy, and we should be prepared for that. And maybe that's a good thing, because when there are no secrets, there's no need for war, no need for spies, no need for CIA, no need for intelligence services, no need to biohack. Everybody's out there and we know everything about everything. This idea of personal privacy may be irrelevant in the future. I already talked to young people, millennials and post-millennials, who are happy to share their data for humanity. They're happy to share their habits. They're happy to share their problems. They're happy to share their vulnerability. So I feel it's inevitable. Transparency and open feedback and systems that are totally open to everyone, open systems, will lead to emergence. And it will not be possible anymore to have that thing that we call my privacy, because it's not possible. That's my take.
I think I would add, I tend to agree. Open systems. The benefit there is that it is shared data. But as a technologist and as a designer, it is a huge responsibility upon us to make sure that it's trusted data, it's vetted data. And we can do this. I mean, these are challenges, but we do this with our technologies, and you look at technological development for humanity. It can always be used for evil or for good. So I'm betting on humanity and the billions of people, let's use it for good. And of course, we need to know when it's being ill-used, but we need leadership. So it's open, to be trusted, to be vetted. And then the personalization, the customization is, again, it's for well-being. It's for, mental health, for physical health. So we can get this right. We can get this right, and the transparency. And guess what? We're going to fail. And so just let's accept that. Let's do better next time. And, we're learning. We're learning beings. We're learning. So we really want to reach our potential. And that's how I say technology should be used in a benevolent way. We should use it we should be very intentional. We had a little bit of talk about the ethics, and again, everyone needs to be at the table to get this right.
To expand on that and what Deepak mentioned, privacy is a little bit dead, but let's look back, 15 years ago, we were still driving with paper maps. Now we can't imagine driving anywhere without Google Maps or Waze, which in a sense is sharing our personal data, our speed and location to build a real-time map of our traffic and to avoid the cops or get there faster. And if you think about the future of health and medicine, we should be able to opt in similar ways to share our health-related journeys, and that can be hyper-localized to enable constant learning and an updated map for your own health journey that can become, again, highly localized, highly personalized. And we can incentivize people to become data donors and realize that when they provide their often private data and opt in, we can get useful data back and share that around the planet in much more impactful ways. Because healthcare has often been very one-size-fits-all based on 10-year-old double-blind placebo-controlled trials. We can become much more real-time. We still need to be careful about letting people opt in and privacy when possible, but it is a new era to connect the dots.
Thanks, Danny. I think Deepak and me always have this conversation that technology will probably get to know you better than you know yourself. You can actually look at your facial expressions, your micro expressions, your voice biomarkers, electrodermal activity, gait, movement, who you are, who you're meeting, and you correlate all this data. There is a chance that AI is potentially going to know you better than your friend or your spouse. So let's paint a picture. This is a closing comment for everybody. What are your thoughts on the future of AI? Personalization, and really building this whole thing about predictive healthcare?
I'll jump in first. Well, I think it's going to be about preventative and living well. That's the opportunity we have in front of us. But again, it's always I'm not sure that the AI is going to know me better than myself. It'll know certain specific data, very helpful genetics and my coding, but does it know what's in my heart and my energy? I think maybe not. So it's a tool from my perspective, and hopefully, helps me with preventative and helps me live healthy, well, and longer.
Thank you, Dr. Newman. Daniel?
My take is that eventually, AI will learn elements about you from your let's say your digital exhaust can be collected, and it can see whether your resting heart rate has changed from 55 to 70, and that might be the sign of an impending heart attack or stroke. So it will give you early proactive warning, idea of a check engine light that can be highly tuned, that data is presented to you both to nudge you towards positive behaviors and inform the whole public health ecosystem. You can imagine we can prevent the next pandemic by using the exudation of different forms of information and providing that back to local communities. Just like in space, the national weather maps are built from satellites, then used hyper locally. So I think it means this new convergence, new mindsets, new design thinking to let the technology get out of the way, make it feel magical and seamless, and connect that to both spirit, health, and biomedicine going forward.
Thanks, Daniel. Deepak, closing thoughts?
Closing thoughts is I agree with everything that's been said. I just want to mention that technology will enable us to resurrect the planetary microbiome, which will have a big impact on the biosphere and climate change and our technologies for climate change. But even more important, I think we are entering an era from human to meta-human. We are entering an era where we will change our perception of reality, perceived reality, and then fundamental reality, which is in our own awareness. So meta-human will be able to conceive, construct, govern, and embed itself into a new reality where we will literally be creating our personal and collective reality. Right now, each one of us inhabits a personal reality. Our consensual subjective experiences is what we call the objective world. But once we understand that everything is intersubjective, even the so-called objective world, go beyond naive realism and even scientific realism to fundamental understanding that everything is conceived, constructed, governed, and comes into existence in consciousness, including technology, then meta-human will be the new species.
Thank you, Deepak. And with that, thank you, Dr. Newman. Thank you, Daniel. And once again, a wonderful conversation. We will now dive deep into the next session with Dr. Daniel Kraft talking about technology, AI, and the future of healthcare.
Thank you. Thank you, everyone.
Thank you.